Hi, my name is Michael, and this is my final reflection for my second clinical rotation. I was at the Challenge Center, which is a nonprofit outpatient neuro clinic that specializes in chronic neuro conditions for patients who essentially insurance has said we're no longer going to pay for therapy for them. So, kind of a last hope um, type setting for these patients. What did I find helpful during my preparation for my second clinical experience? Obviously, the neuro class was great. This particular clinic focuses a lot on the NDT and forced use facilitation side of or approach to therapy. So it is very, very not textbook, which is good because it's a source of knowledge that I wouldn't have been able to get many other places. And I had an amazing experience there. So I think the most helpful thing for me was just going in with an open mindset. My CI, Jacob, told me that, look, I don't expect you to know anything that you haven't already been taught in school. We will teach you that here. But having a good foundation of neurological diagnoses and things that, precautions that come with that were very helpful. What do I recommend to a classmate who will be completing their second clinical experience in a similar setting to prepare for their rotation? If you're going to a neuro setting, patience is something that is very, very important. Definitely, touching up on the, different presentations of, specifically with patients with stroke or who have had a stroke. Going into a session with someone who has aphasia, you have to very much change how you communicate with them. And so that took some adjusting and learning, but there's nothing better than learning firsthand with a patient than compared to in the classroom. And, other things like making sure that you're conscious of, okay, I'm nervous going to work with a patient, but I don't want them to feel that I'm nervous, because if I'm apprehensive or not confident in what I'm doing, then, that can change their buy-in or participation. So that's very important to be confident in what you're doing and, know that your CI will only let you do something that they know is either okay for the patient, safe for the patient, and they'll be there the whole time. So that was something that was comforting for me, that if he was letting me struggle with trying to come up with a creative activity or intervention, that it was good for me to kind of have to struggle on the spot and not just look at him for the answer and be like, well, I don't know right off the top of my head, so can you help? That was a really good learning experience for me. And then another big thing with this particular setting is the number one goal is not you as a student, it is the patient. And so understanding that there are going to be times where, you think, oh, I can do this, but is it the best thing for the patient, or is it better for, maybe my CI to take over and do what we were doing? It just kind of depends. But the number one thing is the patient, not you as a student. And I don't want to say that like they don't care that you're a student and, want you to learn from them, because they do, and they do a very good job at teaching. But ultimately, it comes down to patient safety and what is best for the patient. Discuss specific challenges you experienced and what strategies you implemented, and did it help with those challenges? So the biggest challenge for me with this setting, specifically this site, was that after 2 or 3 weeks of observation, now I was responsible for coming into sessions with ideas for interventions or activities that were going to address patient deficits, or what they call primary impairments. And I also had to kind of figure those out on my own. Not that they didn't, lead me or guide me, but we were never allowed to use the same intervention over again. And so it really forced me to get creative, and they have a lot of unique ways of addressing primary impairments. And so trying to come up with creative ways to work on those was time consuming. And so I had to get up, go to the gym at 5 o'clock, be done by 6. And, from 6:30 until 8:30 when I left for work, I was working on coming up with activities for the day, the next day, the week, so that I didn't show up to a session and essentially just be like, well, I didn't come up with anything, so you're going to have to kind of run the session. And so that was just very time consuming, but it was good because after a couple weeks of kind of like figuring out what we're working on and trying to address, coming into a session and being like, well, I want to try this and see how it works, and then seeing that it does work was really cool. And then on the other hand, when something doesn't work, you have to pivot. And that was also challenging. But again, my CI was fantastic and would, again, not just give me the answer, but kind of lead me to the answer of, okay, I want to work on this. What is something that will drive this movement? And then let me, figure it out. Discuss expectations of your CI and facility, such as time management, documentation, patient safety interventions, DC planning, and anything else I think is important. Expectations, essentially, they had the 7 weeks lined out, or lined up to where the first, I think, 2 weeks were observation. Third week, you start to just come up with 2 activities for each client or patient, which a full caseload was only 7 patients a day. And we see the patients for an hour, and documentation for all those patients is just to be completed by the end of the week because they're not submitting to insurance, which was nice, but also can get caught up in the, I'll get to the notes later, and then they kind of start stacking up. So, but after those 2 to 3 weeks of observation, coming up with activities on week 3, you come up with activities for every session for the remainder of your time there. Like I said, documentation is just to be completed by the end of the week. Then I believe starting the 4th week, I had to come up with a list of primary impairments for each client, which is heavily focused on gait and impairments within the gait and why those impairments are happening. And so that was, again, something that was challenging in the sense that I had to do a very deep dive into the gait cycle and ground reaction forces and why would a patient be compensating with this gait pattern, what muscle either is not turning on or not turning off that is driving that, and then create activities to address those. I didn't have to worry about any discharge planning because a lot of these patients are coming there for years on end. Just again, because, their cases are chronic and they've been dealing with this for years, and insurance-based therapy has said, hey, we're not going to help you anymore. And so that's where the Challenge Center comes in and closes the gap to get them to the highest level of function that they can. What did you like about your setting? Could you see yourself working with this patient population? Absolutely. I was thinking over last summer about what my dream job is, and there was kind of three big things. I want to be able to work with patients or clients long term. So, the acute setting, you're seeing someone on average 3 to 5 days maybe, and then they're gone. That was not something that was super appealing to me. I like developing a relationship with someone and seeing progress. The other one was I wanted to work with one patient at a time for, an extended session. And for us, seeing 7 patients a day was a full caseload, and you see them for an hour each. And I really liked that. And then the last one is, obviously to be able to make a livable wage. And I think for me, that one's the least important because there is just so much to learn with this population. And it gave me a very, very unique approach to creating interventions or activities that will drive movement patterns or motor patterns. And so I absolutely could see myself working with this patient population. Our clinic rotation ended, I don't remember, March 6th or something. And I was like, well, we have 2 weeks off. Can I stay an extra week? Because I've really enjoyed this and I want to continue and learn as much as I can. And they were like, heck yeah, you can stay. And so I absolutely would love to work with that population and, if possible, at the Challenge Center. So we'll see how that goes. But yeah, overall, amazing, amazing experience at the Challenge Center. I could not speak more highly of them. And I wish everybody within the program could at least get some time over there because it is such a great learning experience. And yeah, nothing but good things to say about them.